What if we paid for food the way we pay for health care? We'd have food insurance, grocery insurance. And what would that do? Well, I'll tell you what it would do. I wouldn't care what things cost. I'd buy steak all the time. More steak. Only the best stuff, the most expensive stuff for me. My insurance company's paying. I mean, this seems crazy, and yet that's how we buy our health care. And now they tell us the answer is more health insurance. I think the answer is less health insurance. When this Fortune 500 CEO made a similar suggestion in this article, people tried to shut him down and shut him up.
We believe his reckless and heartless comments should not be rewarded with our profits.
But what if what he offers his employees helps control healthcare costs and gives consumers more choice?
I think I have good health care.
Also, we'll look at profit.
It's disgusting. There should be no profit in healthcare.
Some people are furious that businesses make money off sick people. But I say, good for profits. The bigger the profits, the better.
And now, the man who shatters conventional wisdom, John Stossel.
Good evening. Welcome to my second Fox Business TV show. Now, everyone's talking about how we need to fix health care. And let me ask you, how many think American health care needs to be fixed? Raise your hands. How many of you think more people need to get more insurance? Most of you. All right, so I'm told by Congress and our president that their new laws are going to do that. And by doing that, they're going to make health care cheaper and better.
Choice, competition, reducing costs, those are the things that I want to see accomplished in this health reform bill.
Well, choice, competition, and reduced costs would be good. Hell, they'd be great. But will we get that from these bills? Boy, they're big. Will these give us choice and lower costs? I don't think so. Would you take that and here, read this, get back to me later? Those bills promise more people more health insurance. How will that lower costs? You saw what grocery insurance did to me. It made me not care what food cost. What if your car insurance covered car washes? You'd get the car washed all the time. And of course, our car insurance rates would go up. Yet more health insurance will control health care costs? No way. That's why I'm going to argue something that no one wants to hear. If we want to slow the growth in health care costs, we have to pay more of the bills ourselves. In other words, we ought to have less insurance. Now, most people here don't agree with that. You, for example, think government, would you stand up? Think government should cover more?
Absolutely, I do. There are people out there that are working hard and they still can't pay their health care bills. Even those of us that have insurance are paying too much.
So if government steps in, they can just take care of us?
They need to take care of us. We're trying to take care of ourselves, and yet it's not working. We're still sick. Who wants a nation full of sick people?
Okay, and you agree with that. Would you stand up?
I agree completely. I think the system's incredibly inefficient how it is right now.
All right, that there is a need for government action is the consensus in America. It's the reason also that people organized that boycott against Whole Foods grocery chain when its CEO said the last thing our country needs is a massive new health care entitlement. So stand up again, what would you say to him or like to say to him?
I would say that we need a bill that really covers every single American because
he's saying the last thing we need is a new health care entitlement.
Well, I think that our current system is inefficient. It's not generating, enough.
Government could do it better?
I think that it could. I think that he is wrong, yes.
Well, I wish he were here to explain himself. Actually, he is. Here is John Mackey, founder and CEO of Whole Foods. So, why are you applauding him? He's a rich capitalist. He makes fat profits.
Yes, John, I think
you were booing. That's why I came to you.
Well, I think that's a good reason. Yeah, I think that your plan for high deductible insurance is not at all generalizable to America. I mean, I think that it may work fine for your employees, but it's still far more expensive to do that than it is to have, say, a Canadian-style single-payer healthcare system. All
right. Well, we'll come back to that in a moment. Let me talk more about John Mackey. He built Whole Foods from scratch, and now it's a Fortune 500 company. Frankly, I resent this concept, Whole Foods. Does that mean I eat partial food? I don't buy that, but I should shut up because I'm being rude to my guest. John, what do you say to him and these people?
It's a different vision of the way the world should be. I believe socialism was tried in the 20th century, and it failed miserably time and time and time again.
Why'd you write the op-ed?
Because we do need health care reform in the United States. And I believe we need to move towards market solutions, not towards more and more government control.
Well, I mean, these people have this faith that government would make it better, but Congress seems to believe it.
I don't think they know their history.
What do you mean?
I mean that when government controls things, we don't get higher quality, we don't get lower costs, we don't get better prices. We lose freedom.
What about the people who are not covered, who are scared that they can't pay for their own health care?
There's always going to be the hard cases. There's always going to be exceptions that we may need to provide some type of safety net for. We have government programs now, Medicaid and Medicare. We're spending more and more money on those programs. Medicaid is in the process of bankrupting our states, and Medicare is actuarially going to take the United States into bankruptcy with the unfunded liabilities that currently exist. We need less of that, not more of it.
You say we don't have a right to health care. That sounds cruel to people.
I just don't think health care is fundamentally different than any other goods or services that we have, from food to shelter to cars to iPods to bicycles. The market provides all of those goods and services better than governments do. I don't think health care is any different. The market can provide health care cheaper, more effectively than government can. If we'll just let... The problem is we don't have free market health care in the United States. The government controls it. The government has messed it up. We don't allow competition to work.
And even for insurance, one of your points was that you ought to be able to buy it out of state if New Jersey has stupid rules that make it cost more.
You ought to be able to buy the insurance that you want. And the market will provide that insurance if we'll take all the regulations off of it and let it meet the needs and desires of its customers.
And the regulations now require insurance to cover things I don't want. Alcohol treatment, acupuncture, all kinds of things. And I can't buy it from out of state.
You can't. Imagine if regulations required you to buy certain kinds of food when you came into the store. You must buy that food. You don't want it. Maybe you're a vegetarian. But the government decided you need to purchase a certain percentage of meat, whether you want it or not. So that's analogous, I think.
Now, since your op-ed came out, there's been all kinds of reaction. I found some of it fun. They've been saying some nasty things about you.
You like that part, didn't you?
It's fun for me. I'm in television. I'm not running your business. Here's from your hometown newspaper. The Rockefeller of Rutabagas has come out against federal health insurance because of the expense. Too pricey for the potentate of produce. Here's a guy who charges his customers a caboodle per ounce, and he's worried about Uncle Sam spending too much money to keep you up and running. What do you say to that?
I think that's an amazingly ignorant comment. The reason why is because 50 years ago, our country spent 16% of our disposable income on food. Today, we spend only about 8%. So the cost of food has gone down steadily for the last 50 years, while the cost of health care in the last 50 years has gone from 4% of GDP to 17% of GDP. So food's getting cheaper due to the market system. Health care is getting more expensive due to the absence of market freedoms. The current system is not a market-based system. The government controls it and regulates it and does not allow markets to work, and that's what's wrong with it, and that's what needs to be reformed.
I think when people hear the phrase market, they hear profit. And they figure if somebody's making a profit on health care, it costs more.
Profits are absolutely essential. Profits are what create change and prosperity. The profits get reinvested to make innovations, to improve health care. Without those profits, the innovations are not going to occur. Let's take Canada, for example. MD Anderson, which is a cancer research organization in Houston, Texas, spends more money on research than the entire country of Canada does on research.
In a moment, we'll hear more about the boycott against John Mackey when we return.
Covered.
Now, I'm an outspoken person, so I'm glad I'm not in a business where I have to be careful never to offend. But John Mackey is. He's in a business where the customer is always right. He built Whole Foods. The chain's been a huge success. He opened his first store 30 years ago. Today, he has hundreds of stores. I think he's done a wonderful thing. He created jobs for 55,000 people. And he's allowed his employees to choose very cool forms of health coverage. Plans where they get to control the money. Whole Foods calls them personal wellness accounts. The accounts work pretty well for Whole Foods. Health insurance costs are rising everywhere, but at Whole Foods they've stayed flat. So, as I mentioned earlier, John wrote that op-ed pointing out that we have the freedom to choose our own doctors. So, regarding government care, we should be moving in the exact opposite direction. Mackey never mentioned Obama's name, but the Wall Street Journal titled his piece, Alternative to Obamacare. That raised a ruckus among some of his crunchy granola customers. They started that boycott. One blogger wrote to Mackey saying, I will never, ever shop at your stores again unless you retract that op-ed, apologize for stabbing us in the back, or resign. I predict the next few weeks of your life are going to suck immensely. So, did the next few weeks of your life suck immensely?
Immensely.
Well, how did it happen? You wrote the op-ed and then you vanished.
I wrote the op-ed piece just prior to my going on vacation. I was doing a hike on the Appalachian Trail in Maine and New Hampshire. I really was on the Appalachian Trail.
You weren't like Governor Sanford?
Not in Argentina. I was on the Appalachian Trail. I have lots of witnesses. So I submitted it. I didn't know the Wall Street Journal was going to publish it. I submitted it. Then I went and hiked for a week, came out, and there was this huge firestorm.
Well, how'd you find out?
I came off the trail, and I had my BlackBerry, and I opened it up, and call home John. And there was this major boycott that had materialized as a result of the op-ed piece.
So did that kill your business?
Well, our sales have gone up since the op-ed piece came out.
And, I mean, clearly there are people who stop shopping at Whole Foods because of that. So how do your sales go up? What's your reasoning?
A lot of the boycotters were already boycotting us. I mean, only about 1% of America shops at Whole Foods, so arguably 99% are already boycotting us. And we actually gained a lot of new customers who liked the stance that I took and discovered Whole Foods for the first time.
Yeah, and we have some tape on that. It wasn't as if everybody wanted to punish you. Some people started what they called a boycott. They started shopping at Whole Foods because they liked what you wrote.
John Mackey is an American hero. Long live Whole Foods.
So you'll keep shopping at Whole Foods?
Shopping? Are you kidding? I wish there were thousands of people here. I will always support Whole Foods. Absolutely.
We are the United States of America. And as far as I know, we are still the United States of America. And until I've heard different, he has the right to do this.
This is a boycott. Instead of us coming out here and demagoguing this man for taking a risk and becoming an entrepreneur and building a company, we're saying we're going to reward you for giving voice to Americans.
All right, so obviously I'm glad that they supported you because I agree with most of what you wrote. Let's just talk about a couple of the other ideas. Repeal mandates.
Right now, health insurance is regulated by the states. They're not allowed to compete across state lines. And so special interest lobbyists add more and more benefits that have to be covered. And that raises the cost of the health insurance for people, making the premiums higher and more expensive. It doesn't allow people to get the exact health insurance that will best suit their own personal needs.
Tort reform.
Doctors have to spend thousands and thousands of dollars on protect themselves from medical liability insurance. And they also practice oftentimes defensive medicine to prevent litigation from occurring. We need to reform tort laws in order to free up the doctors to practice in a responsible way without having lawyers looking over their shoulders at every step along the way.
And the lawyers say, oh, tort costs are less than 2% of health care costs, but that doesn't include all the defensive medicine. All the tests done that don't need to be done.
Exactly.
And if we did this would make a big difference?
I think it would make a huge difference. Also, if we repealed the McCarran-Ferguson Act, which was implemented in 1945, which prevents health insurance companies from competing against state lines. It's the only part of business that I know that doesn't compete across state lines. That really limits competition. Competition is what we need. We need competition in order to drive down prices. Every other business has competition. Why shouldn't health insurance have competition? It largely doesn't.
When we return, we go to the critics, including the leader of the boycott. We're back with Whole Foods CEO John Mackey. Some people are furious that he criticized Congress's plans for government health care. Some of his progressive customers boycotted his stores.
It's self-defeating for progressives to support a company whose CEO stands against universal single-payer health care, and we believe his reckless and heartless comments should not be rewarded with our profits.
The group that organized that boycott calls itself Single Payer Action. Its president is Russell McIver. He joins us now from Washington. So you hated what Mackey said in his op-ed.
I think we can agree on a couple of things. First of all, Single Payer Action is opposed to the Obama Democratic legislation as a bailout for the life insurance, for the health insurance industry.
Because you want single payer.
That's right. It's going to force Americans to buy junk insurance. So we're urging our supporters to call Congress and ask that this bill be defeated. Yes, I mean, I was a shopper at Whole Foods here in Washington, D.C. for years. It's a well-educated customer base. They have a lot of money to spend on apples for $1.25 each. And I don't think they were not happy with Mackey's position. And Mackey's position is to keep entrenched this pay or die system. That is, if you don't have money to buy health, if you don't, well, I mean, I saw a Reuters report showing that, they ranked the best companies to work for. Whole Foods was number 3 last year, and it's number 48 this year. So I think we have had an impact that a lot of their customers were not happy that John Mackey took this position that it's going to be pay or die. If you have money, you can get insurance, you can get health care. If you don't have money, tough luck.
John Mackey, what about that? Pay or die?
Americans 45,000
Russell, hang on a
Americans.
second. Let him answer what you said. Pay or die.
Well, I mean, that's nonsense. I don't think that's true. First of all, single payer doesn't create immortality. I mean, everyone's going to die. Regardless of what system, under whatever system we have, we're all mortal beings. We're all going to pass away.
Russell McIver says 60 people die a day because they don't have health insurance.
It's 120 now, John. It's 45,000 Americans every year die from lack of health insurance. So we're not saying people aren't going to die. We're saying in this country, 45,000 Americans are dying from lack of health insurance. You go over the border, 0 Canadians die from lack of health insurance. Why? Because when they're born, they have a health insurance card that gets them free access to any doctor, any hospital in the country. So 0 Canadians die from lack of health insurance. They die from other things, but not from lack of health insurance.
They oftentimes die from a lack of health care as they wait for services that are rationed by governmental bureaucrats.
Very few Canadians would come here and exchange places with us. I have a friend in West Virginia.
Many Canadians come here every year to get their health care because they can't get it in Canada. I don't know many Americans that go to Canada to get health care.
John, I would ask you to pick up a phone and call any Canadian and ask them if they would exchange
we'll
their
never
system
solve
for our
that,
system.
Russell, but state your main point. In your ideal world, government would just manage it the way it's done in Canada or England.
We believe in the death penalty for the health insurance industry. Right now, we have a corporate bureaucracy telling us where and when we can get health care. I went to Johns Hopkins. I got a bill from because they told me.
Tell me your ideal world. What should we have?
The ideal world is if you're a citizen of this country, you get a health insurance card and you get free choice of doctor and hospital. We pay for that through the tax system, just like we pay for public parks and the public highways and public education. We'd pay for it through the tax system.
So public education and public parks work well?
John, would you get rid of Medicare?
Medicare is $36 trillion in the hole.
Would you get rid of it?
It's getting rid of itself. Absolutely. It's a Ponzi scheme.
I know you would get rid of Medicare, and this is the point, that this point of view, this is why people are upset with John Mackey and Whole Foods. He's taking a hardline, libertarian point of view. Even if you go to his website, he has an interview with Reason Magazine, and one of the reporters asked him, what about people who can't afford health insurance? What about someone who's too sick to work and can't get health insurance? What about them? He said, well, maybe charity could take care of them. That's not good enough because we have 45,000 Americans who are facing that situation, who don't go to a doctor when they're sick because they're fearful that they're going to go bankrupt, that the bills are going to overwhelm them.
Let John Mackey answer here.
The recommendations I made in my op-ed piece would lower the cost of health care, not just for people that don't have health insurance, but for everyone. Markets work better than government bureaucrats. That's been proven over and over and over and over again. It sounds good. Socialism always sounds good in theory. It just doesn't deliver the goods.
John Mackey, would you get rid of national parks?
Would I get rid of national parks?
Yes, would you?
You're comparing apples and oranges.
I'm not advocating that government cease to exist. I want government to be into its proper sphere. This isn't the proper sphere of government, in my opinion.
Russell, you brought up national parks. It's a good example. And maybe government should run national parks and the military. But I've covered national parks. They're badly run. I covered a national park in Pennsylvania where they spent almost $1 million to build an outhouse. It didn't even flush. This cost almost $1 million. They imported the stone from out of state. They managed things so badly. I can't imagine what health care will be like once government runs it.
John, both of you guys are of the Grover Norquist school of libertarianism. That is, you want to shrink government to a size, drag it into the bathroom, and flush it down the bathtub. That's the Grover Norquist school. That's what you guys want to do. And what's the result?
I don't know about you, but I'm a proud member of the Grover Norquist school of limited government. When we returned last week, because of stupid government policies, I got a free golf cart. Maybe this week, a free scooter. Okay, the boss of Whole Foods writes a healthcare op-ed based on the health plan his company runs. People get so mad they boycott Whole Foods. So what is Whole Foods' plan, and how is it different from what government wants to do?
We provide high-deductible catastrophic insurance for all of our full-time team members, which is about 89% of our team member base that works 30 hours or more.
High-deductible meaning $4,000,
we round up to about $2,500. It's actually closer to $2,300, but we said $2,500. And so they have to cover their first $2,500, and then the company picks up the cost above that. We also, though, have created personal wellness accounts where we deposit up to $1,800 into a team member's account so they can pay for their deductibles that way. Any money that they don't use, and in any one year, 90% of our team members make no health care claims in a year. So money they don't use rolls over to the next year, so they can use it when they may need it. So over time, more and more dollars builds up in their accounts. So their deductibles paid for, as well as any other types of wellness programs that may not be covered, such as acupuncture or chiropractic.
So they can use it for anything, any silly thing like acupuncture if they want to.
Homeopathy, all the things you don't approve of, John.
And if they don't spend it over several years, some of your employees might have $7,000 in their accounts, and it's their money?
Absolutely. And it empowers them. They become in charge of their own health care, as opposed to you, who may not approve of their choices for acupuncture. They get to make those choices, not someone else, not a government bureaucrat
or
someone in an insurance company. They're making those choices, so they're empowered. I think that's what needs to happen for health care across America.
And your employees like it?
I think they do. That's what we hear from our polls with them and our morale surveys. They like it quite a bit.
Well, some clearly do. An employee stocking shelves in Washington says she sure didn't expect a boycott.
I was sort of surprised by the reaction because I think I have good health care. And what I like about it is I have the freedom to go pretty much to whatever doctor I want to go to. And the money goes on to a card. It's like a charge card. It makes you sort of think about how you're spending what's on your card. The general consensus that I've gotten from talking to people is that people are pretty happy.
And in the audience are some other Whole Foods employees. They call them team members, as John says. You guys are the team members. Would you stand up? You agree with what he says? You're happy with this?
Absolutely.
Why?
Because I'm able to spend the money the way that I want to. I can save it up and keep a certain amount to cover my deductible, and the rest I choose to spend wherever I want to.
And that works? Well, I would think you might not go get a checkup.
No, I go for my annual checkups, and the extra money, you know, I'm more conscious about what I'm eating, my health, because now I have to pay. Now I have to choose how much I need to pay to go get health care, so I'm able to eat healthier, be more nutritious, and be able to go.
Do you ever ask the doctor, do I have to pay that much? Do I really need that test? Do you question your doctor more now?
Yes, because it's in my control. It's my money coming out of my pocket, literally, to pay for what's being covered.
Let me ask you, who's next? Would you stand up? You're also happy with this plan?
I love my health care.
Why?
Well, I'm the mother of 4 children at home, and they all have to have preventative health care, and I'm able to see the doctor that I need to, see the dentist that I need to. I have one child, he had to have surgery. Everything was covered. It was able to cover and pay for my deductible, so I love my health care.
Do we believe them? Maybe they're just saying this because their boss is here. I bet people on this side don't believe them. You want to stand up? You don't stand up a moment here.
Well, yeah, no, I believe them, but I mean, I think that the problem with the Whole Foods solution is that it really is not a model that can work for the whole country, right? Because I have statistics with me right now that show that a woman of 60 on a high deductible plan with a $1,000 deductible will pay, a median in America will pay $4,000. That's more than the total spending, government and private combined, in Canada.
But that's
right?
That's because we invent the cool new things that everybody wants, and government regulates it to raise the price.
The private sector has very little to do with that, right? Most of it's funded by National Institute of Health, other government sources.
The new inventions come from the government, the new pills?
All the basic research does. Either not necessarily the government, but nonprofit. Most of it comes from nonprofit. It's experimented with at nonprofit hospitals. Actually, 4 private insurance companies are very conservative in the kinds of risks they take. They don't take risks on risky new procedures because they don't want to pay out the money for it.
All right, let me hear more from you. You want to add something to that?
Yeah, I just want to say the fact of the matter is the market will never provide universal coverage for everybody that's comprehensive health care. Americans shouldn't have to worry about how they're going to pay their medical bills. They shouldn't have to choose between paying their medical bills and paying their mortgage.
Well, if you're
you're
poor, we have Medicaid.
But there's children in this country that don't have health insurance. There's children in this country that
have
die
Medicaid if they're poor.
Yeah, that's not very accessible to people.
If you're poor, everybody gets Medicaid.
I grew up my life without having health insurance.
Well, then you must not have been poor.
I did not qualify for Medicaid.
Well, are you
denying that I didn't have health insurance? And that
if you didn't have health insurance, you must be fairly wealthy. Why should you get public programs? Do you get them to buy your food or your shelter or clothing?
I wasn't wealthy. I've lived off food stamps. Like that's not wealth. And I've had to pay $500 for removing a fishhook from my finger through private market health care.
John Mackey, he's looking at you. You have an answer to this gentleman?
Again, the current system we have doesn't really allow markets to work. The current system is not a free market health care program. What we need to do is increase competition, and that will drive prices down. That does it in every other section of our society. It'll do it in health care as well if we'll let markets work.
People with health savings accounts say having one changes their behavior. They used to just take the doctor bill and hope insurance paid. Now they ask questions like, do I really need that test? I'm paying cash. Does it have to cost $200? Sometimes the doctors say, what, you're paying now cash? Well, no, I guess it'll only cost $100. And then they don't know where to put the cash because they haven't had a cash box in the doctor's office for years. So suddenly there's a market. People watch their money. Compare that to what happens when government pays or when insurance companies pay.
Round, round, get around, I get around, yeah, get around, round, round, I get around.
If you're having trouble getting around, you need a Hover-Round power chair.
It's a great ride, and it didn't cost me a penny.
The scooter is free, say the ads.
I had no idea that my insurance would pay it, but they didn't hesitate.
They filed all the paperwork, and Medicare and my insurance covered the cost.
Call the scooter store today.
So, does anybody here believe that with a deal like that, the only people who get scooters are those who really need them? I sure don't. This is what happens when government takes over.
No one wants to be in a wheelchair, but people who don't have mobility need to be able to have it. Otherwise, they're stuck in their homes.
Well, it's nice that they get the chair, but
it's not nice. It's necessity for them. They have to have a life.
And your shirt says greed kills.
Yes, and I have been a social worker working in the medical field and seeing how difficult it is for people to get coverage
and
for
greed
basic
is the
necessity.
for-profit businesses
that's what the system is about.
When we come back, I'm going to celebrate profit, that evil profit.
It's disgusting. There should be no profit in health care.
Now shattering conventional wisdom, John Stossel.
Now, we've just heard that health care costs much too much because of profit, because companies make money off sick people.
It's a form of predatory capitalism on the expense of those who are sick and dying.
It's disgusting. There should be no profit in health care.
So you agree with what she said?
Well, I think that even if we're making advances in healthcare due to profit, it's not going to the people who need it because it's not extended to everybody.
But if you take the profit away, how are you going to get the innovation?
Profit doesn't always lead to innovation.
Grace Marie Turner says profits are a good thing. She's president of the Galen Institute, a think tank that specializes in healthcare. And am I correct? You think profits are good?
Absolutely. Absolutely.
Why? They take money from others.
Profits are the reward that we give companies and inventors for coming up with something that's faster, better, cheaper. For goods and services, we don't have enough profit motive in this country. And competition is the thing that keeps the competitors honest so that they come up with a faster, better, cheaper good that is better than the next guy and hopefully even a little less expensive. So we've got to have more of that in the health sector rather than less.
But some people are left behind. Some people can't afford to pay for this.
Absolutely, and that is a problem we can solve without having the government take over our healthcare system. Sure, there are people who need subsidies to purchase health insurance. We should do that, but let them make the kind of choices so that they get the kind of insurance that works for them rather than the government telling them this is the insurance you have to have. That's not what the American people want. The people we just heard from with Whole Foods, they love having choice of doctors. They love being able to go to the doctor they want. If we put up the government in charge with the single-payer system that the audience is talking about, bureaucrats in Washington are going to be able to tell you what you can have or what you can't. And that's going to kill innovation. It's going to keep us from getting to the kinds of solutions that we need to solve the problems in our health sector.
All right, at the moment, a single-payer plan looks unlikely. Congress says all we're doing is we're going to make insurance better. We're going to make sure they don't discriminate against people with pre-existing conditions and that they don't
And we can do that, too, without, again, having the government take it over. I've read much of this 2,000-page bill and much of the House legislation as well.
I feel bad for you.
And you should. But I feel even worse for our country because it's all about rules and regulations and government deciding all the hoops that doctors are going to have to go to. That's the difference, is if you've got the profit motive, if that consumer can vote with his feet to go to a different doctor, to choose a different health plan, then that person is going to be able to get what they need. Right now, that doctor is going to be, if we have this government plan, the doctor's going to be worried about, is he filling out the paperwork right? Is he making sure that he doesn't order too many expensive tests because he might get punished, even if you need that test?
John, do you want to add to this?
I totally agree with everything she said. We can take care of the hard luck cases in better ways than having the government take over the entire health care system.
That's right.
Of course, there are always going to be people that need some care. It'd be better to have the government, through the money we spend on Medicaid and Medicare, to let the people themselves have that money
as a voucher, maybe.
As a voucher type of system. That would empower individuals and give them more control over their own health care instead of making them dependent upon the decisions of people they don't know, with rules and regulations that bureaucrats have determined.
And Grace Breen, let me just quibble with one thing you said. You say it's okay, we could make it sure that insurance companies don't discriminate against people with pre-existing conditions, but that's not insurance, that's welfare. That's like saying you and I should pay the same, if it were car insurance, the same premium that Lindsay Lohan pays.
The same premium. But if you can get health insurance that's going to work for you, and you pay a fair price for that, and you keep that insurance over time, then you don't have to worry about pre-existing conditions because you've got a policy that you own, that you can take with you from job to job. Allowing people to shop across state lines, as you were talking about earlier, is a great idea because it allows people to escape the regulatory regimes in their state that basically say to many people, if you don't buy the equivalent of a fully loaded Lexus, you can't buy a car. Let people have the kind of choices that they want.
With the money we now spend on Medicaid in our country, if you took the same amount of money, you could buy, for all the poor people who can't afford insurance, a high-deductible plan and put $3,000 in a health savings account that they could spend on that deductible. And any money they didn't spend, more money would be added to it the next year. We could empower the poor people to take responsibility for their own lives and health. We don't need the government to take this thing over.
And then they'd be actually able to find a physician to see them, unlike in many cases now where people have to go to hospital emergency rooms because they can't
Let me
find
stop you, because as we've heard, some of the audience are totally in disagreement. We'll hear more from them when we come back. Welcome back. Some people in the audience aren't buying it. Would you stand up here? What, these health savings accounts, you don't think? I'll hold the mic. It's all right.
So I'm an internist, a primary care doctor here in New York, and health savings accounts really work for only a certain type of person. But people who are sick or who are poor don't really get the benefits of health savings account. So a person, for example, I have a patient who has lymphoma. She is 40 years old with lymphoma, and she will exhaust her health savings account because she has a lot of medical bills. But it's not her fault that she has lymphoma. She just happens to have it. And we also know that from study after...
But doesn't she have a high deductible policy that covers the big bills?
It covers the big bills, but it doesn't cover the $2,000, the $3,000, the $4,000 that annually she would have to pay for her medical expenses.
Let's let them take a shot at an answer. John Mackey?
Well, if we had a system where we had health savings accounts and people had them all their lives, when they were young and healthiest, they would be compiling surpluses that would cover them when they got older and their health spending went up. So you have to think about it through the whole life cycle.
All right, but the young person who gets sick is toast?
No, but the point is, if someone is sick, health insurance picks up the great majority of it. Like at Whole Foods, if someone has spent $1 million in a year on health care, they might have to pick up $3,000 themselves, while the company picked up $997,000 of it. But they'd have to pay a little bit, and I think that's fair. I think people should be responsible for making some of the payments on their own health, even in a catastrophic situation.
Grace Marie?
Well, first of all, health insurance, health savings account should be one of the choices that people have, not the only choice that people get. And people can accrue savings over time, but they save money that year for the health care that they get because they save on the premiums. Instead of spending $6,000 or $7,000 or $8,000 on a premium for a comprehensive plan that pretends to cover everything, that premium may only cost them $4,000. So they've got the money. You've got to look at the totality of their total out-of-pocket costs, not just what they're spending with the deductible.
Are you buying this?
For certain populations, if you have enough money and you can afford to spend the $3,000, $4,000 of a high deductible.
Well, he's given them the $3,000 in their health savings accounts.
And what if you get sick?
The whole point of insurance is to cover people when they get sick. And the whole point of insurance is we can't know when that's going to happen. We all need insurance. If we were to have subsidies at someone's lower income, they can use that subsidy to buy the kind of insurance they need. They can put savings into that account if they buy a lower premium policy, but let them make that choice. But it is important that everybody have insurance, but that doesn't mean that it needs to be government insurance.
Well, thank you, Grace Marie, and John Mackey as well. Finally, I'm going to keep saying what people don't want to hear. If we want lower prices without losing quality, we have to pay more of our health care bills ourselves, because the only thing that really lowers costs and raises quality is the free market. Insurance interferes with that. The market works when you control your money.
Save extra at Kohl's Big Weekend Sale.
We all know what happens with everything else in our economy when customers shop around. People trying to make a profit cater to us.
When banks compete, you win at LendingTree.com.
They keep inventing things. We get better stuff for less money. Better cell phones.
Only from T-Mobile.
Faster package delivery.
Reliability for less than you think.
Better everything. What makes it work is that the merchant knows that you can take your business elsewhere. And what gets you to shop around is the fact that you, not the government or some insurance company, pay.
Who the heck is going to shop for price when somebody else is paying the bill?
He's a laser eye surgeon. He works in the tiny area of healthcare where patients still do pay the bills. And what's happened? The technology has improved dramatically. Well, the cost has stayed the same or gone down. Why? Because most insurance plans don't cover LASIK, people shop around. The surgeons work hard to please their customers by keeping prices low.
Because people are paying their own money, they're very sensitive to their experience. Does the doctor make me wait? Does he answer all my questions? Do I get a great result? If there's a problem, I'm out of there.
Nobody had to plan it or pass a law to force it. It just works. That's the free market. So I don't get the arrogance of a handful of people, most of whom have never even run a small business, thinking that they are smarter than the market, that they can reinvent our entire healthcare system. These monster bills that Congress now offers don't address the most basic rule about incentives. We don't care what it costs if we don't pay the bill. These bills force more insurance, more third-party payers, more rules from Washington. These kill the benefits of the tiny amount of free market that's still left in American health care. If we want cheaper and better, we need more Americans to have plans like Whole Foods, high-deductible policies, and health savings accounts. Only when health consumers spend their own money will we get the quality care we want. I'm John Stossel. Thanks for watching. Hope to see you next week.
We want to hear from you. Send us your ideas, your examples of government gone wild, and join our studio audience. To do that, email us or call us.